Hey guys, it's me, the Traveler here. So you remember last week when I was like, I think I'm allergies or sick? Well, I was sick. So it was a long week, but I'm back. And today we are here to talk about the diversity of the patient population you will have based on where you travel to. So one of the amazing things about travel nursing is being able to see different areas. However, with different areas comes different cultures. With different cultures comes different illnesses. It's amazing. I mean, it's not amazing to be ill, but it's amazing to just see the differences, and then you have to adapt to that. Culture also plays a huge role in the healing process, which we know. I always say two things. People always become more cultural when they get sick, and they become more spiritual when they get sick. All of a sudden you get sick and you want all that cultural soup and all that food that, your grandparents made or whatever, and then, if you're spiritual, all of a sudden you're calling on your God and all that stuff. So sickness brings out more culture and brings out more spirituality, which is great. You just have to deal with it, learn to deal with it, based on individuality. When we're in nursing school, we take ethics and classes like that. Well, in my nursing school I did. And that really applies when it comes to other people's cultures and spirituality. Yes, I will soon make a video about emergency room nursing, but in the ER is where you really see your community. If you don't know what kind of community you're living in, go and visit the emergency room and you will see the people of that community. So I'll tell you based on my own personal experience, I've gone to places where I've had a large Oriental population where, you had to handle a lot of cupping, things like where they would burn their children or, stuff like that to take out illness. And it's not considered child abuse, it's all about the culture. You get different illnesses. This one area I went to, we had a lot, I'm talking about every single day we had a death code related to heroin, overdose, stuff like that. They sell Narcan over the counter in CVS. So it's just dealing with different populations, dealing with different cultures, different types of people. I mean, it makes you very savvy. When I was at the heroin cocaine place, no judgment to these people. I'm just saying when I was there, I learned how I was given charcoal and stuff like that. I learned a lot about Narcan and all that stuff that I've never really had to deal with as much before. When I went to the other area where we had a lot of sepsis related to cupping and coining and all kind of other things like that, that was like, wow, you had to really take that culture into consideration when caring for these people. The foods they're gonna want. If you put a diet for them and you're gonna be bringing them a hot dish and they only want cold, just stuff like that. You really just have to be sensitive to the different areas, the different cultures, the different illnesses. If you work in the South, everybody's gonna have diabetes and high blood pressure and high cholesterol. Not to be stereotypical, but the South and the diet and the lifestyle that it brings, that's what you're gonna get a lot of. So even if you don't work in the emergency room, you still have the patients, they come to the ER, they get admitted upstairs. You still have to take care of them and provide that cultural care for them. Do not be judgmental. And then just adapt the most you can. It'll be a great learning experience for you, and it'll be wonderful to be able to be diverse, to give that care to someone else in a different way. You also have the language barrier there, which you're actually going to be surprised at how much you can take care of someone without communicating with them. Now, I speak a little bit of Spanish, un poquito, just because I was born and raised in Miami, Florida. So, I worked at McDonald's for 3 years, so I got that whole McDonald's menu down pat. Come on, somebody. But, so the language barrier is there, but don't forget, body language plays a huge role. So I've had, patients you're so sweet, you're so nice. I'm thinking I didn't even talk to you. All I know is that they had chest pain, whatever. I don't know. I don't speak Mandarin or just other languages. I'm the best with Spanish, but all the other things I'm kind of when you go to certain areas, you are going to have that cultural barrier, which many times will bring a language barrier also. But it's okay. Don't get frustrated with them, because imagine how scary it is for them to be in that situation and not speak English and not really know what's going on and all that. So just have really good body language with them. Show them love through your body language and with a smile. Not only do you have difference in patient population, but you also have different in employee, in co-worker population, and then the difference in hospitals. So if you don't come from a teaching or a magnet hospital, if you go to a teaching hospital, you'll find that a lot of the residents will want to do this stuff. So I'll be in the emergency room. One time I was at this teaching hospital and I was in the ER and my patient had a small bowel obstruction and I'm ready to put the NG tube down and all that stuff, and the resident wanted to do it. I'm like, okay. go ahead. You know, we intubate somebody, I'm ready to like do all that stuff. The residents are like, I want to do it. I'm like, okay. So they have so much more help at these teaching hospitals, and they want to put in the Foley, they want to do this, they want to do that. And so you're like, all right, go on ahead now. Like, I'm not going to complain, you know what I'm saying? So just know that, you know, different hospitals, they have different rules, they have different help. Magnet or teaching hospitals can be very different than non-teaching hospitals, a very different experience. So just kind of know, always know your scope of practice based on that hospital, because many times it's different based on the hospital. Sometimes you can push this medicine or do this at this hospital, then you go to the other hospital and you can't do it there. So make sure you know what your scope of practice is based on the hospital, and then just adapt yourself to the different patient population. Don't get angry, don't get frustrated. Refer back to my video about the qualities of a successful travel nurse, because one of those qualities is being adaptable and being acceptable, non-judgmental. So just keep all those things into consideration. It'll be a wonderful learning experience for you. It'll make you a better nurse, because you're gonna be dealing with illnesses that you wouldn't have dealt with if you stayed back at home. So it's wonderful. Enjoy it, have an open mind, and continue to learn. Alright guys, that's it for this video. Thanks so much for watching. If you enjoyed this video, go ahead and hit that like button. And don't forget to subscribe to my channel so that you won't miss the next one. Alright, thanks guys. See you later.